Imagine, just for a second, having a serious health problem growing right inside your body, but you feel completely 100% normal. I mean, no pain, no fever, absolutely zero warning alarms going off. You go to work, you hit the gym, you sit down for dinner with your family, and you just go about your everyday life. But underneath the surface, something is already changing. Welcome to this explainer. Today we're going to look at the terrifyingly silent early stages of 20 different diseases and conditions. We're breaking down exactly how they hide, why feeling healthy can sometimes be a really dangerous illusion, and what you need to know to uncover these stealthy invaders before it's too late.
Okay, let's dive into this. I want you to really ask yourself, what if you had a serious health problem right now, but felt totally fine? We are so conditioned to believe that illness equals symptoms. We kind of just assume that if we aren't coughing, if our head doesn't ache, or if we aren't feeling dizzy and exhausted, well, then our machinery must be running perfectly, right? But honestly, that assumption is exactly what allows these silent invaders to thrive in the first place.
Because there's this massive disconnect between what you feel and what's actually happening inside. You might feel perfectly healthy, invincible even. But the reality is, some diseases can develop quietly for years, literally years, before any noticeable symptoms pop up. And others might produce symptoms so incredibly mild that you just brush them off as, oh, I had a bad night's sleep, or I guess I'm just getting older. The absolute crucial takeaway here is that feeling healthy does not always mean everything is actually healthy. So here is our roadmap for today's explainer. First, cardiovascular and metabolic threats. Second, organs, bones, and vision. Third, hidden cancers and infections. Fourth, when symptoms finally appear. And fifth, the preventative healthcare solution. Let's kick things off with Section 1, cardiovascular and metabolic threats. Now, what's really interesting about this slide is the stark disconnect between having zero symptoms and accumulating severe internal organ damage. The most terrifying thing about metabolic threats is that your vital organs just don't have internal pain receptors. Take high blood pressure. Your blood vessels are quietly taking an absolute pounding, putting you at risk for a stroke without giving you a single headache. Or prediabetes and type 2 diabetes. Those sweet but toxic levels of blood glucose are silently frying your nerves and your kidneys. Then you've got fatty liver disease, which can literally turn a healthy organ into scar tissue without a whisper of inflammation. And a bulging abdominal aortic aneurysm, it feels like absolutely nothing until it suddenly ruptures. And we can't talk about this without mentioning the ultimate silent assassin driving cardiovascular disease, atherosclerosis. Think of it like rust quietly building up inside a pipe. Having high cholesterol itself doesn't hurt, but over the years, the excess cholesterol forms a really thick plaque inside your arteries. This narrowing process happens in total silence, right up until the very moment it cuts off blood flow and causes a heart attack or a stroke. Moving on to Section 2. Organs, bones, and vision. Silent structural loss. Your vital organs are brilliantly resilient, but honestly, that's a dangerous double-edged sword. Your kidneys and liver can actually lose a massive percentage of their function before you ever feel a single symptom. Chronic kidney disease, or chronic hepatitis B and C, can aggressively inflame and scar your tissue for decades. You can carry these viruses and feel fantastic, all while silently stepping closer to cirrhosis or outright organ failure. To put that into perspective, your liver can literally take a 70% beating before it even whispers a complaint. By the time you finally feel swelling or fatigue, the damage is heavily set in. And this silence extends to your skeleton too. Osteoporosis literally hollows out your foundation, turning solid bone into something resembling a brittle sponge. You cannot feel this structural loss at all. For millions of people, the very first symptom of osteoporosis is the horrifying snap of a spine, a hip, or a wrist after a seemingly harmless little bump. Your senses aren't safe from this stealthy progression either. Glaucoma relentlessly damages your optic nerve. In its most common form, the pressure builds so incredibly slowly that your brain actually compensates. It just fills in the missing gaps as your peripheral vision vanishes. By the time you actually notice blind spots, irreversible nerve death has already occurred. Again, silent does not mean harmless.
All right, on to Section 3, hidden cancers and infections, where we look at unseen replication.
Cancer is essentially your own cells going completely rogue. And initially, they're brilliant at hiding from your immune system. Cervical, colorectal, and lung cancers rarely announce themselves early on. Kidney and early thyroid cancers can grow as these symptomless little nodules, and they're often only discovered by pure luck when you're getting a scan for something else entirely.
Because these mutated cells don't trigger pain or fevers in the early stages, specific proactive tools like colonoscopies, low-dose CT scans, and Pap tests are absolutely critical. They're your only real line of defense. Infections are equally stealthy. Actually, from an evolutionary standpoint, a virus thrives if you don't know you have it, because you're way more likely to spread it around. Several sexually transmitted infections, including chlamydia, gonorrhea, HPV, HIV, and syphilis, can be entirely asymptomatic. HIV, for example, can silently dismantle your immune system for years before you ever recognize that you're sick. You can feel completely healthy while carrying and transmitting these. Testing, not your intuition, is literally the only way to know for sure.
And perhaps the most heartbreaking silent invaders are neurological conditions like early dementia or mild cognitive impairment. The early changes are just terrifyingly subtle, forgetting a recent conversation or maybe struggling to find a super common word. These slight stumbles are almost always written off as just getting older, which masks the true disease while the person continues to maintain their daily independence.
Section 4. When symptoms finally appear. Warning signs.
So, while the diseases we've covered today love to hide in the shadows, your body will eventually reach a breaking point and raise a red flag. And these signs, they must never be ignored. We're talking unexplained weight loss, persistent, crushing fatigue, blood where there definitely shouldn't be blood, a strange new lump, chest pressure, shortness of breath, or unusual neurological changes. If you experience these or anything wildly unusual for your body, that is your internal alarm system screaming at you. It is time to seek immediate medical attention. Finally, Section 5, the Preventive Healthcare Solution, how we fight back. So how exactly do you fight an enemy you can't see or feel? Well, you outsmart it. First, you have to brutally evaluate your own risk factors, your age, your sex, your family genetics. Second, lay those risks out on the table with a healthcare professional. Third, deploy targeted screenings. Get the blood work, the eye exams, the imaging. And this brilliantly illustrates the core truth of preventative medicine. Your earliest, most life-saving warning will almost never be a physical symptom. It's going to be a number on a test result. Find it early, intervene early, and survive.
If I feel healthy, I must be healthy. Look, it's a completely understandable human assumption. We all want to believe it. But as we've seen today, relying solely on how you feel can be a fatal mistake. Your body is a master at compensating, which means it simply won't always give you a warning alarm when things start going wrong.
Because the honest truth is, some diseases just do not announce themselves. Knowing that is quite possibly one of the most important health lessons you will ever learn. So I'm going to leave you with this final thought. Are you just waiting around for a symptom to strike, or are you going to take control and get screened? The choice is entirely yours. Thank you so much for joining me for this explainer, and please stay proactive about your health.